Right. So hippotherapy, so is a use the horse. So horse is a tool, okay, to use to treat various illnesses. Okay, so like especially those children may having various disorder, especially psychological disorder as well as so mainly as a physiotherapist and occupational therapist will be highly helpful. Lot of conditions can treat with hippotherapy. Okay, right. So the hippotherapy is it's a new way of treating the patients to improve, mainly for if the patient may having issues in hippotherapy, it will be helpful for various conditions. Even adults also we can use, but the children are having very good progress when we use hippotherapy. So this is a center I frequently visited, the Green Apple Hippotherapy Center. It's located in Malaysia. Right. So the hippotherapy, it's a word how it came from. It's ancient Greek words. Hippo means is a horse. So horse we are using as a treatment tool. So it is used as a treatment tool in the therapy to derive from the evidence-based practice and sound clinical reasoning skills. So using intentional movements of horse. Yeah. So because horse we can use as a stable as well as we can use the horse with moving. So along with that, we can mobilize the, especially the patient may having gait disability. So those who having, for example, the children may having spasticity with the adductor tightness, like a scissoring gait. So the tightness can get released. Okay, so is especially it will be helpful to improve the coordination as well as to improve the sensory re-education and neuromotor and even cognitive systems, and it is influenced to promote functional outcomes in individuals with physical, psychological disabilities, and even they may have the impairments. Also can treat with the hippotherapy. So hippotherapy is a, you see that hippotherapy initially we can give the children to can get progress, then even use as a riding school. So where the center I went is having the, they give a hippotherapy those who have illness as well as they continue as a riding centers also. Right. So hippotherapy involves a special trained therapist. Yeah, even physiotherapists. So after our graduations, okay, so we can do as a specialized courses. So 1 or 2 years certificate courses will be available. So how we can apply this hippotherapy to the children? Okay, so it's a specialist trained therapist used to horse as a live treatment tool. Yeah, because we are as a physiotherapist, we are using various tools to treat a patient, but we never use any live tool, right? So we are using the real horse. Okay, so for example, we use the bubble board, okay, gym ball. Okay, so these are all the equipments. Okay, so we can able to moderate, but the live tool as a horse when we use, it will give a like a long-term progress. The patients can get gradual progress as well as the patients can get consistent progress, progressions of the patient's problems. Okay, so long-term and short-term treatment goals that are individualized to each patient. Yeah. So according to the patient's needs, so every patients we cannot apply the hippotherapy in the same manners. So we need to assess the patients. So according to the patient's problem, so we need to plan the treatment. So that is the reason as a physiotherapist also we need to learn about the hippotherapy. So the hippotherapy when we may apply, it is a three-dimensional movements of the horse. It mimics the normal movements of the human pelvis while we are walking. So how we are walking, same like even when we may sit above the horse, okay, so our pelvic is moving. So this will be highly helpful to improve the gait. Okay, so it will be give the rhythmic, repetitive and multi-directional movements. It provides the horse, it stimulates to the anterior and posterior swinging movement of the patient. So this will be highly helpful to improve their coordination as well as their balance, right? So hippotherapy as a tools in physiotherapy. Yeah. So under physiotherapy, so hippotherapy is one of the tool. Okay, sorry, hippotherapy is one of the tool under physiotherapy. So the horse itself is not the tool. Okay. So because every horses we cannot use for the hippotherapy. So we need to train the horse. So because the horse is really highly, sometimes it's a very harm. You see that generally if you go for the like a zoo, you see that if the horse, it will be very harm. Okay, so this type of the horse cannot use. The horse need to desensitize. Okay, it need to have a specialized training to treat the as a treatment horse. Okay, so like a hippotherapy. So the horse itself is not the tool, rather it's a licensed physiotherapist leading skilled movements and treatment strategies while utilizing the horse in the tool. Yeah. So as a horse also need to have a proper trained horse, as well as trained physiotherapists only can apply hippotherapy. Right. So here a small video. Just you listen how the child is sitting so the on the top of the horse. Okay. So the therapist as well as the horse caretaker. So there is at least 2 to 3 person must be there along with the child when we may apply hippotherapy. So just listen this video because they speak in Malay. So usually you cannot understand that. You see that a child, a 5-year-old boy, he is sitting on the horse. I don't know the video is not that much clear. Okay, so we giving some sort of the mobility exercises to this child. Okay, so to improve the pelvic control. So this is a cerebral palsy child. You see that we need to use these some of the accessories like a helmet. Okay, like foot straps. Okay, so pelvic strap, like some of the accessories we need to use. Okay, same like the horse also is desensitized, so we make the child sit on the horse and we can apply the therapy. You see that uh, to improve the pelvic control. Okay, as well as the child when we start it's in sitting position, so at the end of the sessions the child can come to standing, so the pelvic control will be improving. So, who are all eligible to can be as a hippotherapist? So, in most of the countries, hippotherapy requires specialization. Yeah. So, even after physiotherapy, so directly because we need to handle the horse, we need to know about the horse psychology. Okay, as well as we need to handle the child. So, wherever the obstacles will be there that we need to notice, so we need to have a special training. Okay, it's a usually will be in 2 years course will be there as a hippotherapy course, and it can be provided as a supervised by the following healthcare professional. Once they have achieved the necessary training and certification, okay, then we will be the hippotherapist. So usually who are all the eligible to be a hippotherapist? Either physiotherapist, okay, occupational therapist and speech and language pathologist, they are actually eligible to do for the hippotherapy, right? Yeah, you see that the same horse, okay, we use for hippotherapy, the same child, so whatever the video what we see early, okay, so you see that we need to use this special helmet for the child, okay, as well as the chin strap, and even we can give a pelvic strap also. So we need to make the child sit on the horse, okay, so we need to train them for various activities, and even sometimes we can move the horse from the point. So usually the horse kept on the sands, okay, so because if, even though if the child may fall, it won't be much dangerous, okay, so it won't have any issues. That is the reason there is a horse taker as well as the physiotherapist. The hippotherapist must be with the patients, at least 2 to 3 person must be there. So usually when we may apply this hippotherapy, the first session the child may having, because how we, for example, when we may apply electrotherapy, we may have electrophobia, right? So after few session of the treatment, we won't have that phobia. So same like the child may take the hippotherapy in first session or early session, need to have more person along with, especially the family members or parents or caregivers must be along with the child. So once the child will be enough practice, after few session the child feel very comfortable on the top of the horse, so the child can able to highly cooperate, okay, so the functional improvement also will be there. Right. So, who can be benefit from hippotherapy? A wide variety of patients of all age, okay, even backgrounds of medical histories can benefit from the use of the hippotherapy. So, especially the pediatric regions, okay, the children may having affect various neurological disorder have good progress, okay, compared to the adult persons. Okay, so the patient's population for hippotherapy typically consists of children. Yes. Okay, so the children are high probability can get good progress with varying psychosocial and physical disabilities. Okay, so this include, but it's not limited to. Right. So most of the conditions like that, you see that neurological conditions we can treat like a cerebral palsy. Yeah. So these center, most of the children have come with the cerebral palsy. Okay. Even traumatic brain injury patients means it's not very acute injury. So once the patients can get acute recovery, so the patients having the hospitalization once come back, the patient may having any movement deficit they may have. So that time we can use for the adult patient. Even Down syndrome, the children are even autism, hyperactive children are can get highly sensitized, the child can get good progress. Okay, even though they may having behavioral disorder, even the children may having muscular dystrophy, even amputee patients. Okay, so amputee patients they may having the for example the control of for example lower limb amputation patients. Okay, so after that they may won't not enough develop to stability in the pelvis. So to improve the pelvic stability, we can give them for hippotherapy. Even stroke patients, yeah. So nowadays, is lot of stroke patients can get hydrotherapy, but it's not very acute stage. Must be remember. So the patient may having somehow they may having stability, they can improve. Then we can apply for hippotherapy. Even multiple sclerosis, okay, some sort of psychiatric disorder, okay, spinal cord injury patients. Okay, so it's not very acute, late stage. Okay, rheumatoid joint disease. Okay, and developmental dyslexia and developmental delay children. You see that various disorders what we discuss here, most of the disorders of the children's. Okay, right. The physiotherapy and hippotherapy, even though even occupational therapists, okay, they will be mainly focused on the fine motor control. So as a physiotherapist, we are focused on the gross motor control. So physiotherapist role is very important in under hippotherapy. So a physiotherapist with specialized training in hippotherapy is able to provide treatment plans so tailored to patient's physical needs and ability to write. Yes. So we need to assess the patient. Okay, the patient assessment is very very important. So before we do physiotherapy assessment, the pediatrician assessment will be there. So once the pediatricians, they will give the points he's eligible to do take a hippotherapy, then we need to do for physiotherapy assessment. We can check the patient's mobility in the all the joints. Okay, how the patient's balance will be there, coordinations, all those things we need to check. So it may be highly poor, so we need to introduce the various exercises to improve initially, then we can allow the patients for hippotherapy. So the therapist will manipulate the horse movements as well as the rider's position to attain functional outcomes of the. So what is the patient's need? Okay, so we need to identify as a therapist. So according to that, we can plan the treatment. Right. So gait training. So gait training, you see that if the initially the child may find very difficulty in walking, especially for example, the patient may having the cerebral palsy. So the child may having the scissoring gait. Okay, so hip adductor tightness so will leads to a scissoring gait. So these childrens we can train them for hippotherapy. What happen gradually? So because the pelvic movements will be there, so gradually the spasticity will go to reduce. Okay, so after that, if you make them for gait training, the child may having very good progress. Okay, and even balance, postural control, even though they may having weak muscles. Okay, so this is a general rowing movements will be there. Okay, so when we make the child sitting on the horse, just we can make them to move. So what happened, the muscle will go to the spasticity will be go to gradually reduce, then we can teach them for strengthening exercises. Even joint range of motions can get improved. Okay, muscle tone, yeah, especially the spasticity, okay, will be reduced, normalize the muscle tone, proprioception. Always we can say, so having the when we give mobility exercises on the horse, so automatically the joint control will be improved. And vestibular input, so we need to give a vestibular input like a, we can give a vocal commands. Okay, so to improve their functions. Right. So these are all the aspects the patients can get improved. Okay, so improvements. So it's not a way. All the patients cannot get like a short-term goal. The patients cannot get a maximum recovery. For example, if the patient is having pain condition, we are applying some sort of electrotherapy modalities, pain will be subside, right? So it's not, we cannot consider within 1 or 2 sessions. So according to the patient severity of the patient's problem, okay, the sessions may be increased. Okay, so usually we can give weekly 1 to 2 sessions. Okay, So periodically we need to either according to the patient necessity, we can increase or decrease the sessions, right? So the improvements, these are all the benefits under hippotherapy. The muscle tone, okay, will be normalized, especially spasticity patient. The spasticity will go to reduce to normal muscle tone, as well as muscle power will go to increase. Gross motor skills like standing, okay, sit to stand, stand to walk. Okay, so after hippotherapy, we can train the patients for gross motor activities. It will be good progress. Even fine motor skill also. Fine motor skills, we can train them, make the child sit on the horse, and we can give some sort of the fine motor activities. It will be improved. Even joint range of motions will be improved. So these all those things we need to do for pre-test as well as post-test. So even before you may apply hippotherapy and after you may apply hippotherapy, you can check how the variations will be there. So the patient may having gradual progress, okay, and endurance will be improved, coordination and symmetry. Either the patient may having the asymmetry, for example, they may having scoliosis may be there. If they may having structural scoliosis, functional scoliosis, you all know that, okay. So if it is, it may be uh, structural scoliosis, they must go for surgery. There is no other option. If it may be functional scoliosis, we can able to correct under hippotherapy, okay. It's like a endurance symmetry of the body, okay. Even they have body awareness, okay. The awareness can create, they can able to gain balance, okay. And even mobilization of pelvis, yeah, pelvic mobility is good progress when we may apply hippotherapy, okay. Even lumbar regions and even hip joint balance and head and trunk control will also improve. Okay, so body awareness, even posture, mobility, hand-eye coordination. Yeah, this is the one. If the child may having dyslexia, most of the children are having dyslexia can get good progress under hippotherapy. Okay, because hand-eye coordinations will be improved. Due to this, what happen? Even though the patient hand coordination, okay, so the fine motor functions they can get a good progress. Limbic system functions related to arousal, even motivation, attention span. That is the reason if the patient may having hyperactive children. Nowadays, this center, a lot of the children are coming with the hyperactive children. Okay, ADHD. Okay, attention deficit hyperactive disorder children can get good progress under hippotherapy. Sensory motor function and improve the oromotor ability. Even voice quality and voice vocal communications will be improved. So that is the reason speech pathologists also are eligible to do for the hippotherapy. And even the child may having emotional and cognitive well-being, self-esteem will be improved. Okay, and because they can aware about the body, so they have confidence. Okay, and didactic and group interactions will be improved, and the child's concentrations all improve. Okay, these are all those things. Is we cannot say either we can apply for the hippotherapy with one or two sessions. We cannot expect this progress. Okay, so this will be according to the patient's problem. Okay, even the hippotherapy, we cannot say hippotherapy can be applied only for the those who have the ill. Even though normal individual also we can use this hippotherapy to improve our concentration. Yeah, you see that this child is having poor in the trunk control. The child is affected with the cerebral palsy. He's a 6-year-old boy. Okay, he's having the poor trunk control. So here you see that hippotherapy we used as a tool to improve the trunk control. You see that you can ask why not, sir? Why we are using hippo? Okay, it's a bit expensive only. Why not we can use for the gym ball? Okay, so gym ball is having, you see that if you may use hippotherapy, it will give more stability compared to gym ball. Okay, so because it's a horse is a it's a live tool, so the patients can get a very good progress. So you see that even though the patients can get faster progress. Okay, so even trunk control, pelvic control. Okay, so this hippotherapy horses, it will be in various sizes will be there. Even though some sort of horses will be very small in size, so it will be in highly balanced, we can able to get improved with the children's, right? What are the contraindications? So what are the patients are not eligible to can take for hippotherapy? Active mental health disorders, yeah, that would be unsafe because they may having mentally disturbed is a, if the child may having mental retardation, usually we can I told is a cerebral palsy children's are indications for hippotherapy. But if the child may having mental retardations, okay, because they will be in unstable, it is not in safe. So same like for acute herniated disc with or without nerve root compression. So already the patient may having disc herniation. So especially when we use the horse hippotherapy, what happens? So we have a movements will be there in our trunk. So this movement, what happen? Already the patient may having herniation. So this will be further improve of compression. This will lead to further complication. I think Cherry 2 malformation, Arnold Cherry malformation. I think the final year physiotherapy students, BPT students, you know about Arnold Cherry malformation. Is a medulla oblongata is herniated to the hindbrain. Okay, so it's a foramen magnum, that is called as a Cherry malformation. So Cherry malformation, already the patient may having the neurological symptoms will be there. So when we may use hippotherapy, what happen? So further it will be increased, it will be severe complication. Atlantoaxial instability. So they won't have atlantoaxial joints is very important for your neck control. Already the patient may having unstable. So further it will be increase. Okay, so it will lead to various complications. So seizures. Okay, so uncontrolled by medication. So any times the patient may chance to develop seizure. Even though when we may apply hippotherapy, that time if the patient may chance to develop seizure, it will be leads to further complication. The patient may chance to fall from the horse, will leads to complications. Okay, so either they may having hemophilia. Yeah, hemophilia is having they may having bleeding disorder. So either they may chance to have minimal skin lesions, okay, skin scratches. They may having bleeding. The bleeding won't have control, so this will lead to severe complications. Okay, and urinary catheter. So already the patient may having under catheter. So if we may apply hippotherapy, what happens? The catheter may chance to move, so will leads to catheter may chance to come out, will leads to various complications, will lead to hematuria, like that complications may chance to develop. Okay, so these are all those things we need to check before you may apply the hippotherapy. If the patient may having this all those things, they have that are in contraindications. Same like for you see that medical condition during acute exacerbation like a rheumatoid arthritis, herniated nucleus pulposus. Okay, so that's a disc prolapse. Okay, this all those things will be in severe complication. Either the patient may having open wound or the open wound may chance to develop any infection, any other pathological fracture, or the patient may having very weak bone pathology, they may chance to develop pathological fracture. Okay, either severe osteoporosis, okay, osteogenesis imperfecta, okay, or even though the patient may having any bone tumor. These are all the patient. Okay, when we may apply hippotherapy, what happens? They may chance to develop pathological fracture, leads to various complication. Okay, and either the patient may having any spinal cord symptoms. Okay, unstable spine. Yeah, if the patient may having unstable spine, already they may having unstable. If you may apply hippotherapy, what happens? The mobility will be increased in the trunk, will leads to further complications. Right. So when we may use hippotherapy, okay, so must use some of the safety equipments, okay, especially with the patients, okay. So before a patient is introduced to the mounts of the horse, okay, so they should be provided proper equipment for riding. Before that, we need to do pre-assessment, okay, pre-hippotherapy assessment. So we need to check either all the patient is having highly indicated or not, any contraindications may be there, that all those things we need to check. Then we need to give some sort of the accessories. Okay, it will be safety accessories, how we do for motor riding. So we need to use the helmet. Same like we need to use some of the accessories. A proper fitting helmet is an essential item, and various sizes should be available for patients so that the appropriate selection is made. Okay, so according to either child helmet or adult, so according to their head size, okay, so various helmet size will be available. So we need to, according to the patient's need, we need to check it which helmet is suitable for the child. We need to properly fix it. And even though the helmet, it should be fit comfortably over the patient head and hit just above the there's a eyebrow line. Okay, it shouldn't be close divisions. Okay, it must be in above eyebrow line. So the chin strap must be there. Okay, so chin strap, it should be snag, it must be properly fit to the child, and avoid side to side movement of the helmet. So if it may be there, the head shake will be there. Okay, so because in the when the horse is moving, okay, the head shake will be there. So due to that, what happened? The immobility, they may chance to develop some injury to the neck, and the other complications will be developed. Okay, so sometimes the helmet may be move out. Okay, it may chance to fall down when they are in riding. Okay, so it must be firmly fixed on the child head. According to the child head size, we need to choose the helmet, and the chin bar. Okay, the chin strap must be properly fit. Okay, it shouldn't be any movements. Okay, and the head shouldn't be in shake, and the patient should also be fitted with the gait belt. Yeah, so when we move along with the horse, okay, so we need to have there is a belt will be there to control our pelvis, as well as the strap will be there in our foot. Okay, so this the things, the child won't fall down during the horse movements. Okay, so often gait belts will possess two handles to ensure maximum safety for both the therapist and patients. Yeah, one handle the patients can hold. Okay, the other belt can hold with the therapist. Okay, to ensure maximum safety for both the therapist and the patient. And the two handles can allow for both the therapist and the side walker to maintain a safe grasp on the patients. Yeah, there is both the sides will be there in the straps. Okay, one the side walker or the parents or caregivers, or those who have the caretaker of the horse. Okay, so he is the one to control the horse, and the other one safety belt will be there with the therapist hand. Okay, and yeah, two handles can allow both the physiotherapist and the sidewalkers to maintain the safe grasp of the patient. If the physiotherapist is holding both the handles, so the sidewalker should maintain the light contact with the patient's leg. It is advisable for the patient. Yeah, because the child either, because we have a helmet will be there, and there is a strap will be there for the pelvis. Okay, so even though the child can move on their trunk, it won't fall on the one side. Right. So, because we cannot use all the horses for the hippotherapy, okay, that is a specialized train. Okay, we need to train the horse for the hippotherapy. Okay, there is a usually veterinary physicians will be there in all the hippotherapy center. The veterinary physiotherapy center, veterinary physicians will be there. He periodically check the horse's health. Okay, so the horse have basic need requirements that include the nutritious food, okay, like grass and hay, and adequate clean water, usually around 40 liter of water every day the horse need to drink. Okay, and sufficient free roaming space and housing. Yeah, that is very very important. Okay, the horse need to move. So if you kept the horse will be unstable, so it cannot able to survive for longer time. Okay, because horse is having the very strong bones. Okay, so it need to move every day, so it need to have a sufficient free roaming space, and even though the housing, either the shelter or having the free roaming space, and the teeth floating. Okay, so they will check the teeth, and the hoof, it's a very very important hoof. Okay, the hoof maintenance periodically every 3 months or 6 months once they will check the hoof, and they will be maintain the hoof. Okay, these are all those things done by the that's a veterinary physician. Okay, and annual veterinary visits for vaccination and coggins testings. Okay, so the horse may have any infected diseases may be there, that we need to check, because the horse must be ideal status to give a hippotherapy. Okay, so every sessions when we may apply hippotherapy, usually the veterinary physicians will be there in the horse farm, and some horses may require additional care due to age and health needs. Yeah, we need to use usually horse age above 4 years. Okay, so usually horse lifespan is around 25 years. Okay, around 20 to 25 years is a normal lifespan of the horse. But if the horse age is 20, it's not advisable to apply for hippotherapy. So same like very young horse also is not advisable. Is 4 to 12 years age of the horse is advisable to we can train them for hippotherapy. Right. So the horse must have no condition. Yeah, these are all the checking, how we check the contraindications for patient. Okay. So because it's a horse is a live tool, so we need to check with the horse also. Okay, so this is the one usually as a therapist we are not doing. So there is a veterinary physician is there in the center. They will periodically check the eligible horse only is advisable we can use for the hippotherapy. So the horse must have no condition that affect treatments or any movement. If the horse may having any movement disorder or they may having any injury in their legs, it is not advisable we can use for the hippotherapy. So because if they may having any injury in the legs, what happen? They have a inadequate balance and the asymmetry will be there. So these horses is not advisable for apply to use the hippotherapy. Okay, the horse must be desensitized. Yeah, that is very very important. Okay, because you see that even though even our household animals, okay, so suddenly it may react. Okay, so it must be desensitized. Okay, so all the horses just we cannot take for hippotherapy. Okay, so that need to be treated. Okay, because they will be in quite calm. Okay, even the veterinary physician they can realize, they can understand the psychological status of the horse. Okay, so it must be desensitized to sudden external movement or noises or even tools, either any tools or pros either physiotherapists may use. Okay, so because if it may be fear, so what happen, horse may be jump, so it leads to the patient may be there in the horse, it may chance to they may chance to fall. So the horse must be able to stand quietly for mounting. Yeah, mounting as well as dismounting, as well as grooming and the tacking. Okay, so that is a the person is there along with the hippotherapist. Okay, he is the one is mainly to control the horse. Okay, so it will be highly desensitized. Okay, this horse will be is a quite very very calm. Okay, so whatever the person can say, it will be highly obeying. And whenever we, especially when we are mounting and dismounting, okay, so that time the horse shouldn't be move. Okay, and this is the one is mainly controlled by the persons is in the to control the horse. Okay, the horse must have exceptional born etiquette. Is the people and other animals should not upset them. Yeah, it's a highly sensitive animal, horse. Okay, because we all won't have much frequent that's a frequently we can contact with this horse. Okay, but it's a highly sensitive. Okay, so those the person is control the horse must be there when we may apply hippotherapy. So these are all the generalized requirements, and facilities may require more in-depth requirements depending on the situations. So here you see that. Me and my friends, okay, along with the hippotherapist. So the blue T-shirt one is he was my student. He was graduated with me, and now he after that he did hippotherapy, and now he's as a trainer hippotherapy. So he's a lot of the children are treated with the hippotherapy. So you see that the child is sitting on the horse. The second picture, okay, the child is having the helmet, okay, as well as they having the pelvic belt, as well as the they where the footrest also will be there. Okay, so both the legs must be rested on the foot, as well as you see that these horses are highly desensitized. Okay, so it's not much harmful. Okay, and you see that quite we can able to very comfortable when we handle. So this type of the highly desensitized horse only we can use for hippotherapy, right? So this is a video we can show. Just a minute. You see that untreated time, okay, the horses must be the eyes must be closed. Okay, because eye is a highly sensitive organ of the horse. Okay, so anything if you take it nearby eye, the horse will be like a temperament will be there. So the horse cannot able to control. So during non treatment time the horse must be in control, so the eyes supposed to be closed on each side. Okay, so this is a one type of the treatment, it's a highly desensitized. Okay, all right. So outcome of hippotherapy. Okay, so what benefits we can get? It usually hippotherapy we cannot specify specifically. We mention this is a period within 2 weeks, within 3 weeks, not like that. So it's according to the patient's condition. Okay, so we need to plan so the how the patients can get progress according to that only the outcome will be there. So these are all the main as a physiotherapist when we handle. See, these are all the main outcome we can gain with the help of the hippotherapy. So reducing spasticity and comforting muscle tone. Yeah. So once the spasticity may be reduced automatically, the movement will be improved. The movement control, coordination, all those things will be improved. Okay. So that is the reason most of the upper motor neuron disorder children, like a, spastic children, like a cerebral palsy children, are can get very good progress with the help of the hippotherapy. Improving control of the head and trunk, even pelvis. Okay, this pad control. So this is the one is main to improve our posture. So promote correct body posture and balance, promote and improving so walking. So once pelvic mobility and stability will be improved within the horse, automatically when later we can train the child walk with the uh, normal gait training. When we teach, it will be is quite easy as a therapist, as well as we can find very good progress. So increasing movements of the joints, so the patient may having any movement restriction, the mobility may be reduced. Okay, so we even you can apply hippotherapy. After that you can apply some passive mobility exercise and encourage the child to do the active exercises, can get good progress in the movements, refusing pathological movements. Okay, as well as in promoting natural ones. Yeah, because they have, when we ride the child with the horse, what happens, the child can able to control themselves. Okay, so the self control will be increased, so automatically the movements, the quality of the movements will be improved, and improve coordination and developing, that is a aesthetic, kinetic and vision and the kinesthetic system. So the patient having the, because all the movements what they are doing, they can able to see. Okay, so the visual cues will be, there's a sense of competition, so automatically the child can get good progress. So almost we can come at the end of the session. Okay, you see that initially this child, he's a 7 year old boy. Okay, he's taking hippotherapy for past 2 years. He is also having mild developmental delayed child. Okay, he's not a cerebral palsy child. He's having mild developmental delayed child. He's having like movement control. He is having very poor in movement control and the trunk control. So they may having the child, this boy is affected with the abnormal gait. Okay, these are all the problems the child may have. And so the child take exactly 2 years in hippotherapy, weekly 2 sessions. Okay, so now the child is have very good progress. You see that the child, initially the child won't have even pelvic control, won't have. So the child, even when they are walking, they find very difficulty to sitting to standing. Okay, now the child, after they getting good hippotherapy, the child have very good in pelvic control. Okay, pelvic control is improved, even lower limb control will be improved. So this child is having developed very good progress in their gait. Okay, so to improve the physical, even mental and emotional well-being of individuals with disability through the equine experience. Yes, equine is like a hippotherapy. So hippotherapy, okay, will give very good progress, but it we cannot expect within short span. Okay, so according to the severity of the problem, so sometimes the patient may can get good progress within short term, sometimes it may take a long term. Right, some other facts about the horse. Okay, so it's a general. Okay, so horse can sleep in standing position, okay, by locking her hind leg or the there's a still joint. Okay, which is like a similar like our knee joint as a human knee. Okay, and especially the horse back legs, the posterior leg are very stronger than in the anterior leg. Even they can able to shift their weight whenever even standing position. okay, they can able to share the weight and shift the body weight will be into posterior. That is the reason the anterior leg, okay, how our upper limb is having for mobility, lower limb for stability, right? So even we cannot able to put our body weight to our upper limb, and same like we cannot able to do mobility exercise to our lower limb. Okay, so that how we do for upper limb and lower limb, same like the horse also, the front leg is mainly for mobility. Okay, so horse is having the four legs, the front two legs for highly for mobility, and the back leg for stability. So the back legs are more stronger than in the front legs. How we have our lower extremity is stronger than in upper extremity. Same like horses, the posterior extremity, both legs are more stronger than in the anterior legs. The horse cannot vomit because of the physiological differences in this digestive system. Even the horses, okay, so even it cannot take the food chew how the other animals are doing, like a cow or cat. So the horses won't do like that. Okay, so it cannot able to vomit because the digestive system or like that. Even it can have a drink a water every day. It's need to have a 35 to 40 liters water is need. Even it will produce the saliva like around 9 to 11 gallons. It's around 35 to 40 liters. Okay, and a horse can recognize themselves in mirrors, yeah, so they can able to differentiate with the other horses. Okay, so it's already I told it's a highly sensitive animal, which is a sign of that their intelligence and self awareness. Okay, so it's a highly intelligent animal. So that is the reasons even war, so initially they use the horse as a in wars. Okay, so later stage only they use as a various aspect because it's a very good in vision. Okay, so horse eye special than in the other animals eyes because it can able to rotate 360 degrees. Okay, and horse can recognize themselves in the mirror, which is a sign of their intelligence and self awareness. Horse can only breathe through their nose, not in the mouth. Okay, so as a human and some other animals also can use the mouth for breathing. Okay, even like a human, but horse cannot able to breathe through the mouth. It can able to breathe through the nose only. Okay, the horses have around 350-degree range of vision. Yes. Okay, so it can able to rotate the eyes around 350 degrees. Okay, so even how we can able to rotate our eyes, same like, but this horse can able to identify the things what happen in behind even far away because it's a very clear vision and hearing. Okay, even though they can able to identify some noises will be there in a very long distance. That is the reason the initial ancient period they used the horse as a in war. Okay, so a 350-degree range of vision, and it can see well in the even dark also. They can how the cat eyes, same like the horse eyes also will be very sharp, even though they can able to have good vision during in the dark. Okay, they can also move eyes, each eye independently to track dangers. Yeah, so they can able to rotate the right eye separately, left eye separately. Okay, and even so the dangers will be there in quite far away. Easily they can able to recognize because it's a highly sensitive animal. So the horses are around approximately 400 types of breeds will be there. Okay, so most of the breeds will be there in UK and Canada. Okay, and US. These countries are having more number of horses will be there compared to the Southeast Asian regions. Okay, so it characteristics vary depending, each breeds are having the different characters. Okay, the horse skeletons has an average 205 bones. As a human we have a 206 bones. Same like horses have a 205 bones are there. They don't have a collarbone. How we have a clavicle. Okay, but horse won't have a clavicle. Okay, so won't have a collarbone, but the total number of the bones are there in a horse is around 205 bones. Right, even though the horse can walk shortly after birth. Yeah, so as a human we can take around 10 to 10 months to 1 year, right? We can able to stand and walk, but you see that most of the animals, okay, can start walk immediately. Even you as we are in village, so we all know about that the animals are after take birth, okay, give birth. So the small one is instantly after a few minutes, okay, within 1 hours to 2 hours they can able to walk, right? So same like horses also can walk after birth immediately. Within few hours they can able to walk excellent, and it has a excellent memory power, and are social animals that from very close bonds with the other horses. Okay, even we can identify the horses, even though you see that if you take a horse in one place, even though after 10 years, if you take them to the place, the horses can able to identify because it's having the very strong long-term memory power. They also have excellent hearing and very strong swimmers. Okay, so hearing also the horse ears. Okay, so in which shape? So even we can identify the horse mode. You see that the picture will show you. Yeah, horse here it can able to rotate 360-degree. Okay, so now the horse here at the like a 180-degree line. So if it may be there, so at the side, so the horse is a quite calm, like that we can identify. Same like if the horse ears may be in front of the eyes, okay, like facing towards anterior, the horses are in the very happy mood. Okay, very happy mood. So it's a quite, this is a one we can identify in psychologically how the horse psychological status is there, especially if the horse ears may be at the back. Okay, both the ears at the back, so the horse will be in like a very sensitive circumstances. Okay, so the horse is not ideal, can go for the hippotherapy. So this we can able to identify, that is one of the uh, assessment we can do the horse is in what circumstances. Okay, so this is about the other facts about the hippotherapy. So today my session is not very elaborately about hippotherapy, just like eye openings. Okay, so even you can, I will give some references behind, so you can refer this, you can find the hippotherapy. Okay, right. So just for you can go for further studies, you can understand about more about the hippotherapy. So I didn't explain it's a very elaborately because it's our sessions will be just 1 hour only. Okay, so that is the reasons I just brief it only. So this will be highly helpful those who do for the final year BPT and as well as APT students. Okay, so this is for your further references. Okay, right, thank you very much.